Hi, my name is Eelena Scherman, and I'm a certified lymphedema therapist and occupational therapist at Santa Barbara Cottage Hospital. And today I'm here to talk about lymphedema, breast cancer prevention and intervention. The lymphedema experience. There are many physical conditions that come along with lymphedema, including pain, skin tightness, heaviness, decreased movement, and strength in the affected limb. Psychosocial issues include disturbances in body image, socializing, intimate relations, emotions, and caregiver burden. Functional limitations include self-care, home and work duties, leisure, fit of clothing and shoes, and sleep. Infections often requiring antibiotics and hospitalizations. What is lymphedema? Lymphedema is a chronic lymphatic disease that results in swelling of one or more body parts. Primary, which is hereditary, occurs in 1 out of every 100,000 persons. Secondary, which is acquired, occurs in 1 out of every 1,000 persons after a surgical procedure, infection, cancer, radiation, physical trauma, or venous insufficiency. This buildup might cause swelling and discomfort and may occur in the arms, legs, face, neck, trunk, abdomen, or genitals. What are some of the risk factors that contribute to lymphedema? Obesity, cancer, trauma, infection, cardiac impairments, vascular impairments, and kidney disease. Breast cancer and lymphedema. 1 in 8 women will develop breast cancer during their lives. 10 to 40% will develop some degree of lymphedema 1 year post-op. 50 to 75% incidence of lymphedema can occur 5 years post-op. Up to 10 million Americans today suffer from lymphedema. Breast cancer survivors and those being treated for head and neck cancer are at highest risk for developing lymphedema. What does the lymphatic system do? It maintains fluid levels in your body. It absorbs fat from the digestive tract. It protects against foreign invaders. It transports and removes waste products. Essentially, it is your body's recycling system, and it is part of your immune system. How does the lymphatic system work? The lymphatic system collects excess fluid that drains from cells and tissues throughout your body, and it returns it back up to the bloodstream, which is then recirculated through your body. What is lymphatic fluid made of? It is made of protein, water, white blood cells, waste products, fat, and bacteria. Each person has a different amount, but approximately each one of us has 600, and they're located in clusters. Fun fact, the lymphatic system recirculates an average of 2 to 4 liters of fluid per day. Where are your lymph nodes? Your lymph nodes are located throughout your body, but are mainly in your neck, armpit, chest, abdomen, groin, tonsils and adenoids, spleen, and thymus. Edema versus lymphedema. Edema is a symptom, volume overload due to an underlying pathology. It is generalized, but if chronic and untreated, it can progress into lymphedema. Lymphedema is a disease. It results from damage to the lymphatic system. It's localized, and it's usually chronic, progressive, and there is no cure. There are 4 stages of lymphedema. Stage 1 is the latency stage, where swelling is not evident despite impaired lymph transport. Stage 2 is where edema reduces completely overnight, but pitting may occur. Stage 3 is where edema does not reduce with elevation, skin changes occur, tissue fibrosis develops, pitting may or may not occur. Stage 4 is when pitting is absent. You have lobules, trophic skin changes, hyperkeratosis, and papillomas occur, which is lymphostatic elephantitis. Below are pictures of stage 1 through 4. Lymphedema treatment. Lymphedema treatment focuses on education of the lymphatic system, the disease process, how to avoid exacerbation, proper skin care, and risk factors. It includes manual lymphatic drainage, multi-layer compression wrapping using foam and short stretch bandaging, range of motion, and exercises including aquatic therapy. Compression garment considerations and recommendations, off-the-shelf garments versus custom stockings, length, compression grade, traditional versus Velcro wraps, and nighttime garments. Who is specialized to treat lymphedema? What is a certified lymphedema therapist? We are a group of nationally certified skilled medical professionals. We provide specialized training in complete decongestive therapy, also known as CDT, which includes manual lymphatic drainage, also known as MLD, compression bandaging, skin care, and patient-appropriate exercise. We can be OTs, PTs, nursing, speech pathologists, and other allied health professionals. Complete decongestive therapy is known as the gold standard. Phase 1 and Phase 2. Phase 1 includes education, skin care, manual lymphatic drainage, and bandaging. Phase 2 consists of compression garments, prefabricated versus custom, and specialized exercises. Principles of manual lymphatic drainage. It is a technique using manual therapy to promote the movement of fluid from a congested area towards a less congested area. Breathing techniques are combined with pressure to promote drainage of deep abdominal lymph nodes. It is slow, it is gentle, it is repetitive, except for when treating areas of fibrosis or scar tissue, and generally creates an analgesic effect. Below are two pictures of my patients, one with head and neck cancer and the other with breast cancer. As you can see, the person with breast cancer has a left mastectomy, and post-surgery, she's had lymphedema in her armpit and her axillary lymph nodes. After manual lymphatic drainage, as you can see from the picture below, she's had a reuptake of fluid in her axillary region, and her arm has returned to baseline. Compression bandaging. It is multi-layered, consisting of non-elastic cotton-only bandages, completely different from an ACE bandage. It increases reabsorption of lymphatics. It assists with muscle and joint pumps. It softens fibrotic tissue. Bandaging, combined with exercise, creates an internal pumping action that moves fluid out of the tissues and back into the vessels of the lymphatic system. Here are some pictures and examples of compression garments day and night. Risk reduction on skincare. On the affected side, avoid insect bites, burns, hangnails, and torn cuticles, receiving shots, having your blood drawn, and taking your blood pressure. Risk reduction continued. Do not overheat. Avoid saunas, hot baths, and sunbathing. Keep the at-risk body part extremity clean and use low pH lotion after bathing. Avoid carrying heavy objects and handbags with the affected at-risk arm. Use an electric razor when shaving the affected areas or do not shave at all. When traveling by air, wear compression garments. Risk reduction, avoid constriction. Wear loose-fitting clothing, particularly bras and underwear. Avoid tight-fitting jewelry on the affected extremity. Avoid muscle strain and elevate your arms to reduce swelling. Please refer to the references below for more information. Again, my name is Eelena Scherman. I am a certified occupational therapist and lymphedema therapist at Santa Barbara Cottage Hospital. Thank you for letting me present today, and happy Pink Week.